Today I'm speaking with Leah Thomas, who holds a PhD in Religion and Society and teaches classes in pastoral care here at the seminary. You have a book coming out in a couple of months, Just Care, Ethical Anti-Racist Pastoral Care with Women with Mental Illness. Can you tell us a little bit about this book and how it came to be?
Sure, I'd be happy to. So from about the year 2010 to 2017, I was actually a chaplain in an inpatient psychiatric hospital in a northeastern state in the United States. And I used to have very fraught conversations with people about, particularly other chaplains, about what did it mean to practice and provide care, particularly with women who found themselves struggling with mental illness and in an inpatient hospital. And so it was those fraught conversations that led me to really investigate what was going on in terms of the care that was being offered in psychiatric facilities. So I actually interviewed 18 psychiatric chaplains in this northeastern state from 3 different hospitals, and I really asked them what was happening in terms of their care, what was happening on the ground. And what I found was kind of interesting. They endeavored to try to see the entire person, to really hold the full humanity of the woman in front of them. And at the same time, though, they felt really constrained by both the Western medical model that they were operating in, which seemed to be very reductionistic and limited the ways that they felt like they could really approach and care for women. What they didn't say, but what I noticed, was they were also limited by their own theories and the ways they talked about race and racial identity. The majority of the white chaplains with whom I spoke could not even speak about the topic of race, much less reflect on the ways it might be influencing their care. So what I tried to do was offer a model of care that was attentive to both the particularity of the encounter, but also tried to capture these broader systemic dynamics that were surrounding and influencing the care that was being provided. So I kind of put the voices of these chaplains into dialogue with the fields of feminist and womanist pastoral care, and also feminist and womanist and liberationist Christian social ethics. And the reason I chose those 2 fields was basically that, feminist and womanist pastoral care, particularly in the last 20 years, has really emphasized the importance of interculturality, the importance of context, and the importance of recognizing that we have been limited by a pretty much androcentric, Eurocentric view of the person and of pastoral care. So they've tried to expand that. But at the same time, they've never really had an explicit focus on the presence of people, and particularly women with severe mental illness. So they do talk about trauma, but they don't really talk about what about all of these other, forms of mental disorder that people struggle with. Similarly, Christian social ethics, particularly feminist and womanist Christian social ethics, really brings a focus onto the structures and the systems and the institutions and the processes that frame the encounter and how those might be impacting and interpenetrating what's going on. So what I was trying to do was sort of create a trialogue of sorts between these voices and these 2 fields, and then ask what ethical pastoral care might look like in that context. And so I created a model that's called Just Care, and true to its name, it has justice at the center as foundational, and it tries to hold both the individual dynamics of the encounter and the sort of societal, political structures that surround the encounter, and then create a care that's attentive to both of those realities.
Wow, fascinating and it sounds like very impactful.
Oh, thank you. Yeah.
You're scheduled to teach a course that will be offered term 3 here at the seminary. What's the name of the course and what's it about?
Thank you for asking. The course that will be offered in term 3 is called Grief Care, Ministry in Times of Death and Loss. And it actually also arises from the seminary, who basically recognized the need for this course. But I, in my own experience as both a chaplain and a pastoral caregiver, recognize that there are many situations in hospitals, for example, where the voices of chaplains are not necessarily welcomed at the table. They're fine if they're there, but we don't really welcome them. But when someone dies, that's when the chaplain gets called, particularly in congregational ministry, right? When someone passes, usually it's the pastoral caregiver that gets called. And so it's really important for people who are entering ministry to have an awareness of the dynamics that surround death and loss, because that is really when they're called upon. And so part of this course will be first recognizing we live in a society where death is basically denied, where there's a lot of fear around death, and where there's a culture that sort of tries to promote eternal youth. And so what does it look like to even try to explore and have conversations around death in a culture like this?
Right.
And so we'll be looking at our own personal stories of death, what we bring into the room, and also all of the sort of dynamics that surround death. But then we will also be discussing a variety of different, really theories of mourning and bereavement. You know, students might have heard of Kubler-Ross's stages of death. That's certainly one of the theories we'll be looking at. But we're also going to put it into conversation with a number of other theories of mourning, and to sort of explore different ways of understanding the mourning process and accompanying someone through that process. And then we'll really be looking at like the variety of sort of dynamics that surround and influence someone's bereavement process. For example, the type of death, where someone was in the lifespan, the coping mechanisms that people have, the type of relationship and how that is connected to attachment theory. And so we'll sort of be trying to create a container by which we can understand someone's mourning process and then be able to accompany them through that. And then finally, we'll be looking at and sort of developing a toolbox, so to speak, for clergy members or chaplains. For instance, we'll delve into what it means to create a funeral, and what are some best practices around that, and how to do that with sort of intentionality and sensitivity to the mourning process.
So thank you very much for speaking with me today, and thank you all for watching.
Thank you.